Dengue fever is a viral infection transmitted primarily by the Aedes aegypti mosquito, notorious for spreading diseases such as Zika and chikungunya. The dengue virus exists in 4 serotypes, which means that a person can be infected 4 times, increasing the risk of severe disease with subsequent infections. The disease is endemic in tropical and subtropical climates worldwide, posing a significant public health challenge in urban areas where mosquitoes thrive. Symptoms typically manifest 4 to 10 days after a bite from an infected mosquito and can range from mild to severe, often including high fever, severe headaches, pain behind the eyes, joint and muscle pain, fatigue, and rash. In some cases, the fever can escalate into dengue hemorrhagic fever, which is characterized by bleeding, plasma leakage, and potentially death. The identification of dengue fever relies on clinical symptoms and laboratory testing, with serological tests being the most common diagnostic method used to confirm the presence of the virus. The primary vector for the dengue virus is the Aedes aegypti mosquito, which breeds in stagnant water found in urban environments. Factors contributing to the proliferation of these mosquitoes include rapid urbanization, inadequate water management, and climate change, which creates more favorable breeding conditions. Preventive measures focus on mosquito control strategies such as reducing standing water, using insect repellents, and installing window screens. Public health initiatives also emphasize community engagement in eliminating breeding sites and educating residents about the disease's transmission. In addition to environmental management, the development of vaccines has gained momentum. The first dengue vaccine, Dengvaxia, was introduced in 2015, targeting individuals who have previously been infected with the virus. However, concerns about its safety and efficacy in seronegative individuals have necessitated further research and development of alternative vaccines. The clinical presentation of dengue fever varies widely among individuals, with some experiencing mild symptoms that resolve within a week, while others develop severe manifestations. The progression from mild to severe dengue can occur rapidly, often within 24 to 48 hours after the fever subsides. Severe dengue can lead to complications such as organ failure, shock, and bleeding, which require immediate medical attention. Early recognition of warning signs, such as persistent vomiting, abdominal pain, and bleeding gums, is critical for timely intervention. Treatment primarily focuses on supportive care, including hydration and pain management. However, there is currently no specific antiviral treatment for dengue fever, underscoring the importance of prevention and early detection. The socio-economic impact of dengue fever is profound, particularly in regions where the disease is endemic. High morbidity rates can lead to increased healthcare costs and loss of productivity, affecting families and communities. In many low and middle-income countries, dengue fever places an additional burden on already strained healthcare systems. Outbreaks often coincide with periods of heavy rainfall, further exacerbating the economic strain on affected regions. Governments and international organizations are increasingly prioritizing dengue prevention and control measures, recognizing that addressing the social determinants of health, such as housing, sanitation, and access to healthcare, is essential for effective disease management. Efforts to enhance surveillance, improve healthcare infrastructure, and implement community-based initiatives are critical components of a comprehensive strategy to combat dengue fever. Global collaborations and research initiatives are vital in advancing the understanding and management of dengue fever. Researchers are exploring innovative strategies for vector control, including genetically modified mosquitoes that are designed to reduce mosquito populations. Furthermore, ongoing clinical trials are investigating the efficacy of new vaccine candidates and treatments. As climate change continues to influence the distribution and prevalence of mosquito-borne diseases, a multidisciplinary approach that combines public health, environmental science, and community engagement will be crucial in mitigating the impact of dengue fever. The emergence of new serotypes and the potential for increased transmission highlight the need for continued vigilance and investment in research, public health infrastructure, and community education to reduce the burden of this preventable disease. Dengue fever has become a global health concern, particularly in urban areas where the Aedes aegypti mosquito thrives. The rapid urbanization of many tropical and subtropical regions has created ideal breeding grounds for these mosquitoes. With increasing population densities and poor infrastructure, the conditions for dengue outbreaks are ripe. Areas with stagnant water, inadequate waste management, and insufficient public health resources are especially vulnerable. As the climate changes, rising temperatures and altered precipitation patterns can also affect mosquito breeding and dengue transmission dynamics. Consequently, the risk of dengue is not only limited to tropical regions but is increasingly encroaching into temperate zones, making it a concern for countries that previously did not experience the disease. The clinical spectrum of dengue fever is complex, with symptoms that can be mistaken for other viral infections. Mild dengue is often characterized by high fever, severe headache, retroorbital pain, and myalgia. Many patients recover within a week. However, some experience a critical phase that can occur between days 3 to 7 post-onset. During this phase, complications can arise, including severe plasma leakage leading to dengue shock syndrome, organ impairment, and, in some cases, death. Identifying patients at risk for severe dengue is paramount, especially in endemic areas. Factors such as age, previous dengue infections, and underlying health conditions can influence the severity of the disease. Therefore, healthcare providers need to be well versed in recognizing high-risk patients and ensuring timely medical intervention to prevent complications. Management of dengue fever primarily revolves around supportive care, as no specific antiviral treatment exists. Hydration is critical, particularly for those who exhibit signs of severe dengue or dehydration. Patients are often advised to avoid non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin due to their potential to exacerbate bleeding. The management of severe dengue necessitates hospitalization for close monitoring and possible intravenous fluid replacement. Health education plays a crucial role in the management of dengue fever. Patients and caregivers must be informed about warning signs and when to seek medical help. Regular follow-ups are essential to monitor recovery and address any complications that may arise. This patient-centered approach not only improves outcomes but also empowers individuals in managing their health. The global response to dengue fever has led to various initiatives aimed at controlling outbreaks and improving disease surveillance. Countries are increasingly adopting integrated vector management strategies, which include community participation in mosquito control and environmental management practices. These programs emphasize public awareness campaigns that educate communities about the importance of eliminating breeding sites, using insect repellent, and protecting themselves from mosquito bites. Collaboration between governments, non-governmental organizations, and international health bodies is crucial for effective dengue prevention strategies. Research efforts are also being bolstered to explore new methods for vector control, such as the use of Wolbachia-infected mosquitoes, which reduce the transmission of dengue by rendering mosquitoes less capable of carrying the virus. Emerging research on dengue fever continues to offer insights into its pathogenesis, epidemiology, and potential therapeutic avenues. Scientists are actively investigating the role of the immune response in dengue infections, particularly how the body reacts to different serotypes of the virus. Understanding the mechanisms behind severe dengue can pave the way for targeted therapies and vaccines. As more countries face the challenge of dengue, the importance of robust data collection and epidemiological research cannot be overstated. Surveillance systems that monitor mosquito populations, environmental conditions, and clinical cases can inform timely interventions and resource allocation. Enhanced collaboration between researchers, public health officials, and the community will be essential in developing effective strategies to combat this resilient and evolving public health threat. Dengue fever presents a significant public health challenge that extends beyond just the immediate health impacts on individuals. The socio-economic repercussions of dengue outbreaks can be profound, particularly in developing countries where health systems may already be under strain. High rates of morbidity can lead to increased healthcare costs, affecting both families and national economies. Hospitalizations due to severe dengue can overwhelm local healthcare facilities, diverting resources from other essential services. Additionally, the loss of productivity when individuals are unable to work due to illness further exacerbates economic challenges. Communities often bear the brunt of these outbreaks, with vulnerable populations suffering the most from the dual burden of health and economic impacts. Therefore, integrating health and economic strategies is critical to building resilience in affected communities and reducing the overall burden of dengue. The role of community engagement in dengue prevention cannot be overstated. Successful dengue control programs hinge on the active participation of communities in both awareness and action. Educating the public about the importance of mosquito control measures, such as clearing stagnant water, using screens, and wearing protective clothing, is essential. Community-led initiatives can foster a sense of ownership and responsibility toward local health outcomes, leading to more sustainable prevention strategies. Additionally, fostering collaboration between local health authorities and community organizations can enhance outreach efforts, ensuring that information reaches those most at risk. Training community health workers to identify and respond to dengue cases can improve disease surveillance and prompt action, ultimately leading to quicker interventions and reduced transmission. As researchers continue to explore new avenues for dengue prevention and treatment, the potential for innovative technologies offers hope in the fight against this disease. Genetic engineering of mosquitoes, for example, is an emerging strategy aimed at reducing dengue transmission. By introducing genetically modified mosquitoes that either produce sterile offspring or carry a modified virus that does not cause illness, scientists hope to decrease the mosquito population and interrupt the transmission cycle. Furthermore, advances in vaccine development are underway, with several candidates showing promise in clinical trials. The continued focus on research and development, coupled with effective public health strategies, is essential for combating dengue fever. The intersection of science, technology, and community engagement will be critical in creating comprehensive and effective solutions to mitigate the impact of dengue and improve global health outcomes.